I do find that dentists don't prioritize the marketing opportunity and the marketing goal they have within their own
Hmm.
practice to talk to them about treatments and push treatments, and even asking for referrals is a massive opportunity there.
This is Growth in Dentistry, a dental intelligence podcast, where we ask the question, what does growth in dentistry mean to you? I'm Steve Jensen, a dated dental nerd and your host.
Welcome to Bite Size Dental Marketing. Today I have Steve Jensen with Dental Intel. Steve, I'm such a big fan. I love chatting with you on the pre-show, and
Yeah, same, man.
Dental Intel is the largest analytics provider out there by a mile. You know, big data hadn't been thrown around too often in 2024, but if there's big data, it's at Dental Intel. Man, thanks for being on the show, but I would love for you to jump into some of the trends that you're seeing in the industry. I know that you guys are constantly looking at the data and analyzing what happened, not just in the industry, but in different types of offices. Talk me through what you're seeing out there.
Yeah, for sure, man. In fact, before I get into that, even for some reason, when we're talking about going down memory lane in the pre-show, we were chatting, and when you just said, Dental Intel is certainly the biggest analytics company out there now. Like, I just did this little 5-second flashback into our past. Like when I joined this company, now we've got over 10,000 practices that we're working with. But when I joined, I think realistically we had like 1,200. I think we were claiming 3,000, but 3,000 was like anyone who we had ever done a sync with or something like that.
All the free accounts you did.
I try to make ourselves sound as big as possible.
Man, we've all been there. We've all
gotta get there. So it was fun for me just to think through, like, man, like it's fun to see how far we've come. But yeah, there's some really interesting trends. I'll say this: most of the numbers we look at year over year actually are pretty uninteresting. Like a lot of numbers stay relatively the same. Like how much are we diagnosing? Sure. Are patients saying yes to something? A lot of those things stay, within a few percentages of each other. There's one over the last 3 years that we've been watching that has consistently crept up and up and up that I think is interesting to talk about. One, so that I hope people that are listening, you're like, okay, that's good to know that everyone else is having the same problem. And then two, maybe we can talk about like some solves. The one that's been creeping up has been cancellations and no-shows. So before COVID, and we can muse about why we think this is the case, but before COVID, it was like 8 to 9% combination of the two. So cancellations and no-shows combined was like 8 to 9%. And now at the end of this last year, we're looking at somewhere between like 13 and 15% on average in the 50th percentile practices. So it's been like creeping up several percentages every year. And now we're to the point where, it's almost doubled from where it was pre-COVID, 4 years later. So that creates a lot of pain. As you know, like, and anyone listening, one empty chair in either hygiene or restorative gets real expensive really fast. And so big problem. Now I'm interested, I'm going to I don't know if this is allowed, Eric, to pin something back on you.
Fire off.
You're doing marketing all the time. And I don't have a firm answer on this. We have a lot of data, but we don't have data on why are these patients canceling or no showing. That's not stuff that practices are collecting and giving back to us. Do you have any perception on the marketing side? Like what might be causing patients to cancel and no show more?
I do. I think there's really three converging factors. The first one is when COVID happened, and again, wherever you land on it, it gave everyone the plausible and unarguable excuse. I don't feel well. Yeah, I can't come in. and you can, and again, I'm not saying maybe you never should have. I'm saying sick people should stay home. But it became incredibly socially acceptable to say, Steve, I'm not feeling well. I can't come in today. And you literally cannot argue with it, right? Because again,
absolutely.
Number one, culturally, it became more acceptable to be sick and cancel.
Yep.
The second thing that I believe happened was as we exited the COVID era and the staff shortages came heavy into play, most offices stopped doing the little detail work that tied a bow on the appointment, that showed value to the appointment. They were more rushed. The overall consumer experience declined. Some offices began to shoot themselves in the foot as they would have schedule weaknesses. They would call Steve or Eric and bring them in from Wednesday into Monday. And as the offices started to move appointments, you empower me to move appointments too. And everyone was working from home. So we had some flexibility in that era. So the first convergent point is it became socially acceptable to cancel. The second one was because of the staff shortages and we were overworked, we were paying less attention to the little things that created value in the appointment. And the third is when we begin to see the cancellations and begin to have holds, we started moving our own schedules around.
Yeah.
And
In
thus
fact, hey, can I say
we
something
taught them
right
how
there?
to treat us.
Can I say
Yes.
something right there? That's actually super fascinating. So one of the things that I saw in the data was I follow like the volume of hygiene visits that are scheduled, and that like has really ramped up post COVID. So there was like this pent up demand for hygiene. So probably part of that came part of this cancellation no show problem. Yes, like people were more likely to schedule, but you're right. I think part of why we miss the little stuff is because I think it almost felt for a while like we had unlimited demand in a lot of practices.
We were
for
never
hygiene.
going down.
We're like, we couldn't go down. So it's like, it wasn't a big deal. Like if we cancel or no show, we can fill those spots pretty like easily because so much demand for these spots. So I think that's worth calling out too.
Everyone was trying to get in. Yeah, I totally agree. And I think those three things came together to put us here to where we are now on the second two. The first one, there's nothing we can do, but we're now sort of reaping what we sowed on how we treated patients during that time. And I don't think it was intentional. I think we were responding to market forces and market demand. But I think we're in the real place of we have cheapened ourselves to the end consumer in the dental industry, and we need to push to get that value back.
I love that. And then the question becomes, okay, so we find ourselves in this problem. How do we work towards resolving it? I think is always, the right mode of attack. So if you're sitting there thinking like, okay, how do I change some of this behavior? Basically, one of the cool things that's a cool part of my job is I get to look at all the dental intel customers and see who are the best performers in any given metric. So there's a group out of Boston. They've got 7 locations. And it was fascinating. The average cancellation and no-show rate across each location was between 4 and 5%. So like wicked low. So low that I was convinced, for those that don't understand how like cancel and no-show data works, you can game it. So basically in Dentrix or EagleSoft or Open Dental, if you just like drag the appointment to a new appointment slot so it like disappears, you don't tell the software that you're canceling it or no-showing it, then it just like disappears. And from a data perspective, there's no historical log that said it ever existed in the first place. So it can make your cancellation and no-show percentage look low. So I was convinced like these guys are not canceling appointments the right way, or they are sometimes, but not all the time. But jumped on with them, and that was not the case. So I have found a consistent pattern. These guys were the first ones, but then now over the course of 30 plus more practices, interviewing them, a few consistent patterns, things that practices are doing to help reduce that cancellation and no-show rate to like 4 or 5%. Like that is something that's possible, which I think for some might sound crazy, but it is. It's absolutely possible. Dr. Markowitz is his name. You guys reach out to him. He gave me permission to share his story. So one of the cool things, he shared this story with me, and I thought it was brilliant. So he shares this with his whole team, and his team is actually sharing this with their patients so they understand the importance of confirming appointments. So one of his team beliefs is they want to have as near 100% appointment confirmation rate as possible. So everyone's probably using some solution to send out text message reminders, confirmations.
Right.
And, maybe 40%, maybe 70% of your patients are responding, C or yes to confirm, but it's not 100. And so something has to happen to confirm. And he shared this story. He said, Steve, I want you to imagine that you schedule lunch with a buddy for 6 months from now. It's 5 days before lunch. You both have it on your calendar. 5 days before lunch is supposed to happen, you text your buddy and say, hey, man, just checking in. Want to make sure we're still good for lunch. And then he ghosts you, like no response from that friend. And then you text him the next day and you're like, hey, man, still haven't heard back from you. Just want to make sure we're good for lunch now in 4 days. And then he's like, you do it again 3 days before and you still haven't heard anything from your buddy. And he posed a simple question, Steve, are you going to go show up for lunch if your friend doesn't ever confirm with you? And of course, my answer was no way. I'm not showing up for lunch because that friend is not showing up for lunch, right?
Absolutely not. Unless I had some rude wrong number.
Yeah, that was exactly wrong number. So he said, look, like that's what he has trained his team. Like when they think about the confirmations on their schedule, he's trained them to think that way. And they're sharing that story consistently with patients. So if they have a patient that didn't confirm, that does show up randomly, They just let him know, hey, look, like, imagine that it was a buddy texting you, like, we need you to text us back and just let us know you're coming. Otherwise, in general, we're filling those slots with people. You know, we're going to make it work this time, but we need you to confirm. So they've trained their patients really well and the team to make sure they get 100%, as close to 100% confirmation rate as possible. Here's the second thing that people probably didn't catch. So first one, confirmation rate is really big. We're managing that to make sure it's as close to 100 as possible. The second thing, he actually has his automated reminders. Most practices send those out like 48 hours and 24 hours before the appointment. He actually does what I said, 5, 4, and then 3. And he leaves his team 2 days, essentially 2.5 days, to reach out to these people to finish that confirmation process. So the reason for that is because he wants to be able to manage the schedule with several days in advance if they've got to refill that spot from someone not confirming. So that was a really interesting change where me, conceptually, I probably would have done the same as most dentists. Like, hey, 2 days before, 1 day before, and good enough.
The problem, what he's maybe intentionally done is you're probably not likely to cancel it 5, 4, or 3 days. But when I text you the day before, I have a clear vision on what I have in mind. And it's easier for me to justify option B over going to the dentist.
Yeah, that's a really good point. I hadn't thought of that. I'm sure that plays into it.
Yeah. And at 5 days, I probably don't have my schedule tomorrow handy, and I'm just going to commit to doing
exactly
it.
Where, that's a really good point. Yeah, very interesting. So that's the second thing that he does is he pushes the confirmation and reminder text a little bit farther than I think most people do when I was looking at engagement settings. So I can see that as well. So that was interesting. The third thing, and this is more of a retention behavior, but does have to do with the way that people keep their appointments, is they have, with their hygiene and their restorative teams, a habit of always scheduling the next visit. So we call that hygiene reappointment, or the pre-appointment percentage, the total number of patients that are scheduled in the future. And so they have a really high pre-appointment percentage. And what they do when they're rescheduling is they reemphasize the confirmation, the need to confirm. They also always share in the text messages that they send out, as well as in that moment, hey, just so you know, if you have to cancel or no-show within 2 days before, we have a $50 reschedule fee. And they even say this, we don't really charge that to people. Like, we hardly ever do it because people show up. We'll send you text messages 5, 4, and 3 days before to make sure you've got ample time to let us know if that's going to work, so we don't get to that point. But they train their patients really well to let them know, hey, like, that 2-day window is like a no-go for us, though. We've got to have decisions made before that. And he said that those things are ultimately what are impacting his cancellation and no-show rate in a huge way. So it's been really fun. I've been teaching practices that over that was like 6 months ago. And it's been really fun to see as their no-show rates have started to come down, cancellations have come down, especially now that we're getting through kind of this first cycle of hygiene and folks are starting to figure out how to message that better. It's been really fun. So that is one of the big things that I'm seeing, is that cancellation and no-show rate going up. You got something to say, chime in.
Yeah, that's so great. Whenever I hear offices talk about it, and even coaches talk about it, I hear them say, oh, challenge people when they call to cancel.
Yeah.
Candidly, that's a loser's game.
Yeah, that's true.
By the time that I'm calling to cancel, I've already decided to get, like, now you're just the jerk who's challenging me on why my excuse. If you call me and say, I can't make the appointment, what am I really challenging?
Yes.
Like, you're a grown man. Like, I have the value needs to be created at, like, I love what you said about making sure that when the hygienist reschedules, that they're like, look, this is a really busy time and I'm reserving this schedule for you. And man, when you cancel on me, this is what it does to my schedule. And I may not be able to get you back on the schedule. And I need you to confirm 2 days in advance, because if you can't be here, that's a really big deal to me personally. And I love it when they make it personal, because that value needs to be added back into dentistry. And I love dentists. They're the salt of the earth, but I've never met a group of people who work so hard to commoditize themselves. And it's just like, man, you need to provide that value, and your team needs to provide that value, because that's what I'm coming for. I'm not coming to get my teeth cleaned. I'm coming for my oral health. I'm coming to make sure my overall health is impacted, my overall hygiene and oral health. And I think that's where I love it how you articulated that around they changed the paradigm and they're not asking them 24 hours in advance. And my dentist texts me a few hours in advance, and they're doing it to make sure I come in.
Yes.
But they're also allowing me to cancel.
Because like, oh crap, I forgot.
And
I'm double booked now.
I can't go.
Yeah.
Yeah.
Mm-hmm.
And I think it's one of those things where, yes, I see how we got here, but I very much like the 5 to 3 day confirmation instead of letting me
Yeah,
cancel it
I
in
thought it
advance.
was
But
really interesting.
that's amazing.
Let me add like one more
Yeah.
layer to this. So we have this
Please
cancellation and
do.
no-show problem that's been going on, like it's been increasing now for several years, which means, now if you look at some of the ADA surveys, like doctors and teams are starting to feel more pressure to keep the schedule full. Like it's harder to keep the schedule full now. Like this pent-up demand is kind of wiped away. Things have normalized
Hmm.
now. And now we're left with this cancellation no-show problem. And so one of the other things I hear, and you're in marketing, so you probably hear this as well. A lot of folks are like, hey, like I got to get patients back in my practice. So like I just need a shiz ton of new patients to get us back to
Hmm.
where we were
Hmm.
before. And one of the things I thought, we were pre-gaming a little before, and I thought it'd be interesting for folks to hear. There's a lot of amazing things about new patients that come to the practice. So a lot of things that are true. Doctors are looking for, new treatment that they've never diagnosed before, mouse they've never seen. And that is really healthy for a dental practice. We need to have a consistent flow of new people coming in for sure. Because
It's
it's
exciting.
exciting.
It's exciting to say
Exactly.
it's super
And it's
exciting to talk about
and
new
I think it's
patients.
good from like an
Hmm.
emotional standpoint. You get to develop new relationships, meet new people. It's interesting, it's not the same old, same old. Hopefully there's some value to everyone listening in community. Like there's power in just knowing people for years and years and years and years. And I hope you find some
Hmm.
meaning in that. I certainly do. But no, I think it's good to bring new patients in. But there's something that people need to be aware of with new patients, or maybe a handful of things. So I did this interesting study a couple weeks ago. I was just interested to see with practices that are growing at a really high rate. So they're doubling their patient base. They're adding 50% new patients, meaning they've got 1,000 patients and they're ending the year at 1,500 new patients. So they're adding quite a few new patients every single month. My question was, how do they perform from a case acceptance standpoint? How do they perform from a patient retention standpoint? How do they perform when I look at the full kind of diagnostic and retention experience down to a number I call annual patient value? That's the number that tells me, like, when I plug a new patient into this thing, what's it going to yield me after a year? In all of those metrics, the high growth practices actually performed below average. Now, that's not to say that high growth is bad, but I think it's to highlight a couple of things. Intuitively, I think this will make sense that new patients in general are less likely to say yes to a next appointment. They're less likely to say yes to treatment because we haven't established a long-term relationship of trust yet. It's not to say they won't, right? Every new patient, also, I'll call this out as well. Every new patient has potential to turn into that long-term patient that is more likely to say yes to treatment, that is more likely to say yes when we want to schedule them for the next appointment, more likely to pay their bills, right? So all of those things, right? We have to have new patients to get there. But I think there's a conversation to be had around, okay, now we're trying to figure out how do we get our practice schedules back full, and maybe that like mix we want to play. Like how much of that do we want to funnel through, marketing to get a bunch of new patients, and how much of that maybe do we want to focus on reactivation or retention efforts? So you've got a big smile on your face. I want to hear from you, Eric,
Yeah.
some of your thoughts there.
No, it's funny you mentioned those things. Too much growth can inhibit overall success in a practice because you become myopically focused on the new patients and you forget that I'm getting older every year.
Yep.
And the needs I had from a dental perspective at 48 are very different than when at 40 and from 35. I do find that dentists don't prioritize the marketing opportunity and the marketing goal they have within their own practice to talk to them about treatments and push treatments, and even asking for referrals is a massive opportunity there. And but I love what you said. I am more likely to do business from an orthodontic standpoint, from an implant standpoint, after 3 to 4 visits than I am at 1 to 2.
Yeah, and that's probably a better way to say
fact,
it than put it all on new patients. Yeah, the number of visits is what impacts that. That's right.
Yeah. And in fact, we've noticed a very powerful shift in the industry over the last 10 years. 10 years ago, 8 years ago, I don't think 6 years ago, but I'll say 10, 8, we used to market procedures. So a crown or an implant, and we still can market all on fours, but it is significantly more successful in today's, the way consumers consume media,
Mm-hmm.
the way we think about the brands we deal with, we're now focusing on marketing the connection between the dentist and the patient and talking about why they got into dentistry and their approach to dentistry and what they would tell someone who came in for the first time. We're using marketing to accelerate that emotional connection. And I think that's from a marketing side, we're doing the same thing that you're talking about. Is a new patient is great, but you do need to balance across your portfolio of patients, some time toward existing patients, some time toward new patients. But it's really about that emotional connection for us that we're trying to accelerate in marketing. But it's funny. It's interesting that your numbers hit on sort of one of the core beliefs we have as a company. There's 12 ways I can replace a tooth. The emotional connection is actually what will get the consumer to decide how to move forward.
Yeah. Oh, 100% agree with that. Right. Yeah. So
Mm-hmm.
there's this interplay between, you know, how do we get back to a more normal, busy feeling schedule? And for sure, I think, you know, as you guys look at your practices, and I should mention this too, I don't know if this is okay for me to do, but if anyone ever wants to like take a peek at your numbers, that's something that I'll do for free. Like if you just want to hit up, you can just ask for Steve at Dental Intel, and I can install Dental Intel for free, and I can just like jump on, do a review with you. Do you ever do that too, Eric? Do you ever just like review people's numbers with them? Anyway, I'm happy to do it. Eric's probably happy to do it because he's a total nerd.
I'd love to. I'll do it with Steve. Me and Steve will jump on together and review your practice. Now, you've had to see a ton of practices.
Oh, yeah.
And what do you mostly find when you review the numbers?
Yeah, what are the most consistent things that are good, or the most consistent things that need some work?
Either one.
Yeah, I like to think. Yeah. I share this about Dental Intel with people. I find that it I think this is like relatable. Like there was a time when doctors would do dentistry without radiographs. Like there was a time when that was a reality. And what a gift that we've had improved imaging come into the space to get like a full picture of the health of the tooth, where it's strong, where it needs restoration. And the way I frame dental intelligence is that same way. Like there was a time, and it wasn't that long ago, you know, we're talking 5, 6, 7 years ago, when dentists didn't have a tool to give them a full picture of the health of their business, right? So that's what we're trying to do with analytics, is really get like a full 360 picture of the whole health of the tooth to understand like where is it strong, where is it healthy, and where is it struggling. And so yeah, for sure. There are like, I mean, just like with teeth, right? Like people that don't floss, like you're going to consistently see cavities, you know, in between the teeth. Like that's just what you would expect. Same thing with businesses, right? So the common things I see when I jump on, patient retention is always poor. That one still surprises me. The average pre-appointment for the whole industry is still around 50%, which means like the average practice still is scheduled to lose half of their patients unless they do something about it, call these people, text these people, email these people. So that one has always surprised me. You know, we can always get better at patient retention, and that has a lot to do with experience. That has also a lot to do with processes and tools, like the way we approach that whole problem. Another consistent problem that I see is a fall off between diagnosis and treatment getting completed. Is a really fun place to dive in to see like, hey, where is treatment falling through the cracks? Doctors for years before DI have always loved tracking patient case acceptance, which is just I present a full treatment case, and do they say yes to something, which is always high. Even in our numbers, it's high. It's like 75 to 85% of what gets presented. Something gets done. Yes. But I think it surprises people when I tell them that only 37% of the treatment getting diagnosed in dentistry ultimately gets completed, right? So there's this big drop off, a pretty big cliff to be worked on, where it doesn't have to be that big. You know, it's pretty common to see doctors that start focusing on that number go from 37% up into that, you know, 60, 65%. Pretty difficult to get above that,
right? Unless
you're doing like pretty basic dentistry, you know, like drill and fill, highly likely to say yes to it. You know what I mean? You can get it higher than. But
I think it's also hard to get above that number because you're probably presenting options.
Oh, that's there too. Right. Yeah. So
I can do a bridge or an implant.
Yes. So our data is going to include options from the dollars perspective for sure. Yeah, absolutely.
Yeah. So 60 would be stellar.
Yeah. Great. Yeah. That's very fair. So like, there's things like that are like always like there's always bread and butter for us to fix on patient retention. There's always improvements to be made, like in the clinical workflow, stuff that's dropping through the cracks. And then hygiene, I think, would probably be the last one that's like I always see when I jump in. Hygienists just have a really bad habit of doing bloody prophies, and there's not a whole lot of like really skilled periodontal diagnosis and treatment planning and presentation happening. And I think the belief there is that they're doing good by the patient by only billing them for a prophy. But in reality, they're, in a way lying to the patient about the reality of their health. And,
Absolutely.
So we want to make sure. I'm a big advocate for like, hey, like if someone has periodontal disease, you need to tell them and clinically mark that that's what they have. Like I'd be so upset as a parent if, a doctor heard some like heart palpitations, but it's like, well, that's really expensive if I tell them what's really going on. So I'm just going to tell them, something.
Yeah, they probably don't have the money to fix this.
Like I'd be so mad. And I know that like maybe like gums don't have the same, maybe don't feel like they have the same weight as heart, but there's all sorts of studies about, the oral connection to the rest of the health of the body. So, anyway, that's been a big talking point for us over the years too, is there's lots of clinical improvement because hygienists all mean well. Like they want to do best by patient. I've not met a hygienist who's a scum ever, I don't think, but that's behavior that is pretty commonly found when I dive in.
Yeah. When you were talking about the trends in the industry and life before, we had a time when everything was on paper charts and before radio. Yeah, absolutely. So when you contemplate your time at Dental Intel from 2018 to today, when you look back, what has been the biggest shift in the dental community mindset in that time frame for you?
Yeah, that's a fun question. There's some like
I have my answer locked in, but I'm gonna try not to change it when I hear yours.
Sweet.
But if yours is better, I might lie. But go ahead.
So we're about, between us and competitors, we figure we've got about 15 to 20% of practices that are using some analytic solution. So that's great to see. Still lots of space there to improve. There's a couple of measurable things that have been fun for me to watch. So some of the things that we've rung on from like a retention standpoint, like when we first started, the average hygiene reappointment percentage for practices that we worked with was in the 65, 67%. And this last year, it was at 85%. So there have been some numbers that we're
big improvement.
Like we're preaching, when performance is measured, performance improves. And we're actually seeing that with our client base. Like the longer someone's a DI client, the better their performance is across the board, which is really fun to see that we're having a measurable impact by introducing, solutions that we're providing into the space. So that's very fun for me to see. And then I think the second thing I would say is I hear our terminology. So the metrics that, didn't exist that we created or that we've been evangelizing, I'm hearing people use very similar or parallel phraseology about the way we talk about a business. And that's very fun to help bring in this like new way of operating in the business. I might make some claims around like our ability to help private practices stay private if that's their desire and, be successful with DSOs.
Yeah.
There's some cool things there, but I think I'll name those two. You had an answer locked in. I'm interested to hear what yours was.
No, I was looking up there's some saying around what gets measured gets improved.
Yeah, what gets measured gets managed.
What gets measured gets managed. Yeah, there's something around there. So if you just radiate out enough information about the practice, I would, of course, want to improve the numbers. Yep. For me, my answer is, and I have a few data points to talk to. When we first started back in 2014, 2016, we would get a fair number of practices who, when we would talk about marketing, they say, I've never done marketing. I don't know that I've heard that in the last 4 years, like not once. I've heard, I did not like my marketing team. I've heard, I don't know what I've heard a lot, but I've never heard in the last couple of years, I don't do marketing more. I think as we've seen consolidation come in and we've seen the rise of the educated consumer and and the disinformation out there as well is very high. We've seen, at least this is my answer to my one question. I think we've seen the shift from, I think 10 years ago, a dentist could come in and be a clinical dentist and their operation would run effective. Yeah. Not great,
I think that's
but effective.
Fair, yeah.
I think today they have to be a CEO first and then a dentist to be successful. And that has shifted in probably the last 6 to 8 years pretty dramatically, where I do think there's more competition. I do think that more organizations are investing in marketing. I think the next big bastion in dentistry to tackle will be online scheduling.
Yep.
And I think it's one of those things that culturally dentists resist because their schedule's this, beautiful Mona Lisa of their creation, and consumers don't want that.
Yeah, no.
And I think that with the rise in competition, the investment of private equity money, the education and disinformation out there that consumers are experiencing, dentists are now having to be good CEOs first, and then they have to be a good dentist.
Yeah, I like
and
that
that's
answer
been
a lot.
one of the biggest shifts. Yeah, but I think it's in alignment with yours. I can remember when we would talk about new patients, and again, I'm going back to 2015, 2016, 2017, 2018. We were telling them they're new patients.
Yeah, they had no idea.
42, you had 40 D0150s, and you had 5 45s. And they'd be like, "Oh, that sounds really good." And I'm like, "Yeah, that's really good." And now they're calling me preemptively saying, "I only have 20 new patients scheduled. What are we doing?"
Yep.
So we've seen a big shift in the operations. Yeah. Well, gosh, Steve, thank you so much for all your time and knowledge. I would love to have you back. It's just such,
this is a
nice
blast,
to find
man.
such
It's
a
so
kindred
fun.
soul. And man, I love the research you guys do. And if any practices out there want Steve to use his big, beautiful brain to snapshot your office and provide insights, dental intel is amazing.